government-run option, or is it just off to the side, pushed under the rug for a little while? Here's what we know. Democratic senators strike a deal Tuesday night. We hear that, at least in this round of the Senate bill, they are dropping the government-run option, instead going for a national plan run by nonprofit entities set up by the private sector, and adding a special Medicare buy-in program for some people 55 and older. Is that a good deal for you? How much will it cost? Senator Lindsey Graham joins us. Senator Graham, it's sort of interesting about this so-called deal.
Right.
We don't know much about it. I mean, and what happened to that transparency business?
Well, in March 2008, the president, but here's the difference. I'm going to do it all on C-SPAN so that the American people will know what's going on. Last night, Harry Reid said, we've got a deal. Can't tell you the details, but it's a good deal. I have no clue. I'm a United States Senator about to vote on how to change 1/6 of the economy, and I'm as much in the dark as you are about what they're trying to do.
Salary. Yeah, the thing that's so annoying is that we pay the salaries, and we ought to at least know what's going on. I mean, you know, we give you guys the right to vote, but at least, you know, how about cutting us in on a little bit?
I would like to know myself. The Republican Party's been completely cut out. This is negotiations among Democrats to find 60 votes. They've come to the conclusion that Republicans don't matter. And if you add new people to Medicare, they've cut Medicare by $500 billion. It's $36 trillion underfunded. When you look down the road in the next 75 years, the promises we make to the baby boomers are $36 trillion short of being fulfilled. They're retiring by millions, and there's going to be 2 workers for every retiree. So you're either going to raise taxes on the next generation of Americans or start cutting benefits. That's without adding anybody. What if you cut Medicare by $500 billion and add 10 or 12 million more? You've destroyed the country's ability to save Medicare from bankruptcy, and we're $50 trillion responsible for Medicare and Medicaid and unfunded liability. That's all the money that has ever existed in America.
All right. Are the Democrats going to get 60 votes? That's the first thing. Question. Second is, have they peeled off Senator Olympia Snowe? That's the second question. And the third question is, are you going to bad vibe her in the halls if she's peeled off to the Democrats?
I think Olympia was going to really reject this idea of adding new people to Medicare and cutting Medicare because she knows it's unsustainable now. I don't believe she's going to go for this private plan that has a public option trigger. At the end of the day, she's not going to vote to add $2.5 trillion to the national debt and destroy our ability.
So you don't think the Democrats are going to get her?
I don't think she will.
Okay, that suggests. Do you think somebody?
Will they all rally? You know,
how about Lieberman?
You know, I talked to Joe. I think they're going to have to convince him this is sound policy. I would hate to be the Democrat that voted for a bill that took the problems that Medicare has and made them worse because so many Americans depend on this. If you add new people, it's going to put pressure on the system that's already serving 65 and older. Something's got to give.
If you raise the issue of Medicare, it seems to me the biggest challenge for Senator Harry Reid are those Democratic U.S. senators who have been governors. You have Senator Ben Nelson of Nebraska. You've got Senator Evan Bayh of Indiana,
sure.
And I think there might be another one. I think Senator from Delaware. There might be another one.
Yeah, there's several governors in the Senate.
I mean, does Senator Reid have those former governor senators in his pocket at this point? You know,
I think they're bluffing, quite frankly. I think they're trying to create the image they've got a deal. Nobody in the campaigned on the idea that we're going to cut Medicare by $500 billion, take it out of the system to pay for a new form of health care. Nobody during the presidential campaign said that we were going to add new people to Medicare 55 and above. If they had said that, they'd have gotten laughed out of town and would have lost.
But when I went back and read the editorials for the Nebraska newspapers, Senator Ben Nelson, he has his state newspapers are not happy with him. I mean, not that necessarily, that's at least 2 votes.
Well,
but I mean,
he's a fine fellow. He promised us, he promised the nation, if the public funding of abortion is not changed, the Senate bill doesn't have the STUP Act language. He offered language on the Senate floor that would prevent public money to be used to pay for abortion. And he lost. And he told us and he promised that if that's not in the bill, I can't vote for the bill. We'll see what happens there.
But what's he saying now? But I mean, today I thought he sort of softened that viewpoint.
Get him on here and ask him.
I thought he sort of softened that viewpoint in the last 24 hours.
Well, at the end of the day, that's a promise made to the unborn. You know, what good are you in this business? You know, he's a fine fellow, but you don't say things like that unless you mean it. That's a promise made to the unborn. Don't break it.
All right. There are no Republicans involved at all in this discussion with Senator Reid?
I can't tell you what the deal is.
Don't you think that's appalling?
It's 1/6 of the economy. Change. Remember how we were all hopeful that Washington was going to change? This is a joke. We're talking about a bill that no one knows the details on our side. We've been closed out completely. We're talking about changing Medicare in a way that's bizarre and dangerous and crazy, and I have absolutely no input. This is not what people hope for.
I think we should know. I mean, I know you think you should know because you're a U.S. Senator, but I think we should know as well.
The bill should know. Every American on Medicare should know. But you don't know. And the fact that you don't know and they won't tell you says a lot about their product.
Senator, thank you, sir.
God bless.
Coming up.